Thank you, Mr. Chairman. Earlier this year, I helped to lead a bipartisan letter of 60 of my colleagues in support of the Medicare Advantage program. Medicare Advantage is a critical choice for seniors in West Virginia. 43%, and it's growing every year, are in Medicare Advantage, 189,000. Most of the beneficiaries of Medicare Advantage spend approximately 40% less than Medicare fee-for-service beneficiaries, which is critical because 53% of those beneficiaries are below annual incomes below $25,000, so cost is an issue. In the 2024 advance notice for Medicare Advantage, CMS proposed changes that I believe, and my colleagues believe, hence with 60, anytime we can get 60 on a letter, that tells you something, could result in beneficiaries experiencing higher out-of-pocket costs for prescription drugs for a very popular program that people have adjusted to and really, really like and want and request. Can you provide assurances that the proposed policy changes will not lead to increased beneficiary costs or disruption of Medicare Advantage seniors in 2024?
Senator, I absolutely can provide assurance that the benefits that Medicare provides that are administered, whether it's through the Medicare Managed Care program, what's called Medicare Advantage, or whether it's provided through the traditional Medicare program called fee-for-service, that the benefits that Medicare calls for in the law are not changed, are not diminished, and therefore should not be cut. If they're cut, it's not because the federal government has asked for them to be cut. It's because the provider has decided to make cuts in certain areas. They're not allowed to make cuts to Medicare benefits. They may change the package of benefits that they provide within a particular plan and may change out certain benefits, but they are not allowed under law to cut Medicare benefits from any beneficiary. And if they tell you they are going to have to, then I say to you right out front, that's an unequivocal untruth.
Well, I'm asking you the cost issue, though. Will the changes that you make or that you want to make in the Medicare Advantage program result in higher costs to the Medicare Advantage recipient and the person who's chosen those programs?
Absolutely not. We are actually providing more money this year for the Medicare Advantage plans than we did last year.
So what's causing the stir then?
Well, they don't like that they're not getting as much money as they're accustomed to getting. And
well, how could they not be getting as much if you're getting more?
Well, they've been getting very large increases year over year, and that's because they oftentimes, as you perhaps heard, they overcode. They list someone as being more ill, more sick than they are, and as a result of the higher coding, they can bill a higher rate. They don't like that we're going in and saying, no, we want to make sure it's an appropriate coding. So if someone has diabetes, okay, we'll reimburse you for the diabetes care, but you got to show us that you're giving diabetes care. Not just say it, then not provide the care and still bill Medicare.
Well, I just think the satisfaction numbers alone of Medicare Advantage are big. And again, personal experience with this, with both my parents being on Medicare Advantage plan, easy to do, easy to understand, and out-of-pocket costs very, very low. So we've got our eye on that one. And a quick question I have on...
And Senator, if I just
Yes, you can. Yeah.
There are absolutely plans that are doing well, doing the right thing, and doing well by their patients. Absolutely.
Oh, thank you. The last question I have is, the budget includes a proposal for $20 billion in new mandatory funding for pandemic preparedness and response. So I want to be clear here. I am supportive of efforts to bolster our nation's pandemic preparedness and response. But I am concerned that this is sending mixed messages, because HHS came to us last year for $82 billion. So now it's down to $20 billion. What's the difference in this request? Because it wasn't granted, because it was just for a lot of reasons. I'll leave it like that.
Honest truth, we could use the $80 billion. We don't expect that you all will give us the $80 billion. We hope that you would at least give us the $20 to $30 billion, because in order to prepare, let's put it this way, to prepare takes a lot of work. We saw how much we had to spend once we were in the pandemic. We could absolutely use that money to prepare, to get states better prepared, But we want to be realistic. What will you move with? We think that $20 to $30 billion is a good place to go that gets us at least in a place where we're preparing.
And I would just last comment, the pushback on the original request last year, a lot of it was, you're sitting on a bunch of COVID dollars that are still not going to be spent out for several years. Why can't we, repurpose those?
Well.
I think that's a legitimate question. I'll leave it to that. Thank you.
Okay.